There were more arrests in a Senate hearing about healthcare Tuesday. On May 12th, the birthday of Florence Nightingale, nurses advocating a national single-payer plan took center stage at a Senate Finance Committee hearing on healthcare reform. The roundtable, conducted by Senator Max Baucus, was organized without the participation of any expert, doctor, patient, or healthcare provider, or anyone talking about a single-payer non-profit option. To tell us what happened at the hearing, we welcome Geri Jenkins, registered nurse and co-president of the California Nurses Association. Welcome to GRITtv, Geri. So, yeah, more arrests. There were some last week of doctors. This week it's nurses. What happened?
Well, you know, we went in and did a silent protest. We had our red scrubs on, and we had a sign that said, "Nurses save patients first, stop AHIP, pass single payer." As you know, AHIP is the American Health Insurance Program's lobbying group. And we stood in silent protest facing first the cameras who who broadcast congressional hearings, and then we turned and faced the Congress members on the dais and made a silent protest before we were escorted out by the police. And some of our people did stay back and, spoke up and said, put single payer on the table. And 2 nurses and 3 physicians were arrested today. And then we had a pretty good rally out on the curb, keeping the momentum going about what we think needs to happen here.
Well, let me ask you, just for people who are watching the news, they might have heard, President Barack Obama brokered a deal with some healthcare industry groups, or the private insurers, who are saying they're going to cut their costs voluntarily. For people on the outside, reform may be advancing apace. Why the ruckus in front of Baucus?
Well, these people have said before that they would do these kinds of things. We'll reform, we'll cut our costs, we'll look at this efficiency, that efficiency. And the reality is that nothing ever comes of it, and there's no teeth or enforcement in what they're talking about. And we really think it's important that we have an honest, open discussion about what single payer is, put it on the table, cost it out, see how it compares to these other things, and let's talk about it. And so to freeze it out of the process without any discussion while we're talking about trying to come up with some kind of serious health care reform that'll benefit the citizens of this country, we think is really inappropriate. And we strongly believe that a single-payer system is the most equitable way to create a uniform standard of care and the most cost-effective way to do it. And we believe that would be definitely the way to go. So we just want to get our voices out there.
Who's responsible for who gets selected to testify in these hearings, Geri? Is it all Max Baucus, the Montana Democrats' fault, or who's in charge?
Well, Max Baucus is the chairman of the Finance Senate Committee, and any bill that gets to the Senate for a vote on health care is going to have to get through his committee. He's also one of the largest recipients of health insurance industry lobbying money, and for him to come out right up front, which he did, and say single payer is not on the table. Now he's saying, "Oh yes, it is. Let's talk about it." But that was not his initial position. So. We think it's important to hold their feet to the fire and make them put it out there and have a discussion about it. So I think we went a long way to doing that in the last week or two with these demonstrations and getting some attention paid to what's really going on in these committees. So we think it's important that there be a single-payer voice at the table.
Why? What difference does single-payer make to you? And nurses, you're not typically out there getting arrested. This is clearly taking your action up a notch.
Well, the single-payer proposal that we support is, of course, John Conyers' bill, H.R. 676, which would take Medicare and expand it to cover everyone. It would be publicly financed, but it would be privately administered, so you'd still have the hospitals and the doctors out there giving the care. It would just be funded through a tax base through the government to the providers. So you have complete choice in going to any doctor you want. So you have total choice. It's just the funding source is controlled differently. It's not run through a for-profit system that's basically just there to manipulate the money. I mean, the insurance industry provides nothing towards creating a quality standard of care. It's just like a clearinghouse for the money, and they take a third of every healthcare dollar off the top and put it in their pockets for profits, shareholders' dividends, marketing, CEOs' wages, the usual kind of things we see. So we think that money needs to go back into the system to provide care, and we shouldn't be having to balance human life against profits. I mean, it's not the appropriate place for a free market profit incentive to be in healthcare. There's too much at stake.
How does it play out for you as a nurse? I mean, again, for you to decide that you and your members, and you've got the protection of union membership, but this is still a risky thing to do, to go and be protesting and getting arrested in the Capitol, not to mention scary. For you to do that, you must feel like there's a real personal stake. What is it?
We're kind of like to put soldiers in the fight. We're at the bedside 24 hours a day, 7 days a week. A big primary part of our goal is to be a patient advocate, and we see the ramifications of this broken, disjointed system every day at work with the patients we care for. They come to us sicker, they have out-of-control comorbidities, their diabetes is out of control, their blood pressure is out of control, they don't see doctors frequently enough or at all, and then they show up in your emergency room sicker than they need to be, and that's way more costly to care for than if you had a system where people could access it when they needed it. It's much more geared towards preventive care because the government's not going to the government's going to have a vested interest in making sure you stay healthy if they're, paying the bill, as opposed to insurance companies who take the money regardless. And
what's going on tomorrow, Geri? We're going to check in with you again on tomorrow's program, but you've got things planned for tomorrow too.
Well, tomorrow we have formed an alliance with some other unions and nurses groups, and we are coming together for the first time and hoping to put together a national nurses movement. Tomorrow we're going to be celebrating that new alliance. We have a nursing omnibus bill being put forward by Senator Boxer that will address safe patient standards, nurse-patient ratios. 20 to 72,000 people die every year in this country from a lack of nursing care in hospitals because nurses are asked to take care of way too many patients than it's safe to care for. So
all right. We're going to catch back up with you tomorrow and follow that. Congratulations on your action today, and we look forward to hearing what goes on tomorrow. New alliance building there. Geri Jenkins, registered nurse and co-president of CNA, the California Nurses Association. You're watching GRITtv. Much more coming up. Stay tuned.